So, doctor, a lot of work that you do deals with something most people probably either take for granted or don't think about, and that's breathing. How important is how we do that? Most people probably don't think about that.
As I take a deep breath in, as I say, most people don't think about it at all. People think about it when they're singing or when they're exercising sometimes, and they have these specific breathing patterns. It's extremely important because how we breathe, and there's several aspects of that, but how we breathe actually can impact our health. Okay. It can seriously, in some ways I say, even cause many of our symptoms. So I think it's extremely important.
So what do people need to know? Talk about that a little
bit. In my classes and when I work with patients, I teach them, I put it into a category of about 8 aspects of functional breathing. So now I'm going to have to remember them. But the aspects of functional breathing are really important for us to know. And as you said, we don't think of that. Who taught us how to breathe? I mean, I was in choir when I was in high school, and so I was always taught, breathe down here and breathe a certain way. But singers don't breathe properly. And when I talk about the aspects of functional breathing, I'm really talking about for the two of us right now. We're sitting here. We're not exerting any energy. We're not running from a lion. We're not bolting out of here because there's an earthquake. We're even not moving furniture. So it's not that we're doing everyday physical exertion. We're just sitting here and we're using brain power. We're talking. So when I talk about functional breathing, I'm talking about in our day-to-day life when we're not exerting any effort. The first aspect of functional breathing is really posture, and it involves not just how we're sitting or standing, but also where we're breathing. In ideal functional breathing, it should be diaphragmatic. And most people have heard that. There is a slight difference between diaphragmatic breathing and belly breathing, but for what I teach most people, we're just thinking about down here. Breathing diaphragmatically has a number of benefits for us, which I'll get to in a second. What I want to say is the other aspect of breathing is it should be through the nose. And that's easier to deal with because when we breathe through the nose, it slows down our breath. It moistens our breath because when we breathe in very dry air, it causes our lungs to constrict, our bronchi to constrict. As you know, being in a really cold area that's really dry, you breathe in, you feel like your lungs are seizing up. So it filters the air so there's not extra particles, which also affect our lungs and keep them open. And it slows down our breathing rate, which is another aspect I'll get to. So the first part is breathing through the nose, and then diaphragmatic. One of the exercises I have most people do is they just put their hand on their chest and their belly and they just sit for a while and notice which one moves first and which one moves most. And as I'm doing that right there, a lot of people think they need to take a deep breath. And they take a big breath and the whole body moves. And that's not necessary. We don't need that much oxygen. When we breathe diaphragmatically, that's how we're designed. The diaphragm sits under our rib cage, and it's a dome-shaped muscle. And basically when it's innervated, what happens is that dome flattens out. And if that dome flattens out, it pushes all the contents around here out. It's the most efficient way to breathe. When you see people breathing up in their chest, they're using what we call accessory muscles, extra muscles to breathe. And that takes a lot of effort. So our muscles in our neck, our trapezius, our scalenes, our levators, all these other muscles help us try to breathe because we're trying to expand the lungs. Basically with breathing, you have the thoracic cavity and the abdominal cavity. I like to think of the thoracic cavity is like empty space. It's like a balloon. It's open at the top. If you stretch the balloon, the negative pressure comes in and air will come in. So what we're doing with the diaphragm is we're trying to create more space in the thoracic cavity so the air can come in. Easy, no effort. The abdominal cavity is like this jelly-filled thing, and when the diaphragm moves, it pushes everything out. many people don't want to breathe diaphragmatically or abdominally because,
Sure.
my belly's going to move and I don't want you to see me do that. Yeah. Because we're told we're supposed to hold it in. That's not efficient. So I'd ask people, like, even if anybody's listening right now, it's like, as they listen, hold their belly tight and try to breathe. That's
It's all
effort.
there, yeah.
Muscles will get tighter, they'll constrict, they'll spasm, and it's not efficient. It's not a great way to expand the rib cage enough, the lungs enough to get that air in. So we want it to be so easy. So the first part of functional breathing is diaphragmatic and through the nose. That's one aspect. Another aspect, I guess, in keeping with that, if I'm going to list them, is posture. We want to be in a posture that allows that to happen. And I say this all the time. People have heard me say this. I've done this in other talks. I talk about the standard American posture. It's like if you're driving,
Yep.
or you're watching TV, or the one I see at school all the time, people are looking at it's like, and then they're doing this with their neck. If I do this, what I'm doing is I'm forcing the rib cage onto my abdomen, and then if I try to breathe, it doesn't work, and it's constricted. So I start to breathe here, and what that means, if this belly can't move the way it's designed, other muscles are going to say, hey, we got to do this. This is why we feel fatigued. This actually fatigues our muscles, and we don't have enough energy. It's supposed to be effortless. Now, many people, because they've sat in this posture so long, find it extremely difficult, if not just painful, to sit up. They can't have proper posture because these muscles are tight, those are relaxed, these are tight. And so to sit up takes effort. And this is why I say to everybody, you need massages every week. You need body work. You need to do something to help release that, because that's going to affect your breathing. So we've got the nose, the diaphragm, we have the posture. The other aspect of breathing is the rate. And if you look in normal physiology texts, average physiology texts, they say that the normal breathing rate is somewhere between 14 or 18 breaths per minute. That's what's normal. That's what most people do when you take their breathing rate. It's not necessarily functional in a long-term thing. When we do that, we wind up over-breathing for many people. And it affects our nervous system. What I talk to people is taking about 4 to 8, anywhere from 4 to 8 breaths per minute.
Really?
When we do that, we slow down our breath. We change our CO2, O2 concentration. And I can get into this whole biochemistry if you want. I could map it out if we had something. Oxygen's not the main thing. We all think that, we need more oxygen. Sure. For some people with congestive heart failure, emphysema, lung problems, kidney problems, that may be the case. But for most of us, it's really CO2, carbon dioxide. Most of us blow off too much CO2. Frequent sighing, taking in big breaths, and pausing after they inhale. Those build up oxygen and get rid of CO2 really quickly. CO2 is responsible for actually allowing the red blood cells to get rid of the oxygen and deliver it to the tissues. If we don't have enough carbon dioxide, and this is hard for most people to understand, we don't get rid of the oxygen, it doesn't go to the places it needs to, and when that happens, our blood vessels constrict, our muscles spasm. It's a very complicated thing. Most people can understand this way. People who have a panic attack and they start to hyperventilate. And everybody knows the treatment for that paper bag.
Yeah.
What are we doing? We're recycling CO2. We're getting more CO2. When we breathe too much oxygen and we feel panic, what do? We crave more oxygen. We crave more air. The brain says, I need more air, because it isn't getting to the tissues. The blood is oversaturated with oxygen, which means the red blood cells don't release it to where it needs to go. So we breathe more. The tissues are, help me, and we breathe more, and we breathe more. Doesn't help. When we start breathing in the CO2, then everything settles down. The blood vessels open, the lungs open. So if we can remember that, I know it's hard for people to remember all of that. The key point of that is over-breathing doesn't help us. And I see this all the time. Patients will, you ask them a question and they go, no, how are you doing? Or when we're thinking, it's like, oh, wait, 2 + 8. And we tighten everything up and we hold the breath in. And that actually stimulates our sympathetic nervous response, our fight or flight response. That long-winded explanation is really saying slowing our breath down. Slowing our breath down. Now remember, we don't want to overbreathe, so we can slow our breath down, but we don't want it to be a huge volume of air. So we're not slowing it down and going, we're slowing it down, breathing diaphragmatically, belly, but just taking a small sip of air. And because our postures are relaxed, we're not tightening up to do it. So it's a slow breath. The inhale and exhale are usually equal, or the exhale is longer. The inhale is never bigger because, again, that would go too much oxygen. So that's another aspect. The inhale to exhale ratio is either equal or exhale is longer. And there's no pauses. There's no long gaps. It's just nice and fluid. If I was tracing my breath, it would just be flows into the out-breath, flows into the in-breath, easy. When that happens, our nervous system gets into balance. As a result of that, symptoms happen. There's less symptoms that happen, less disease processes that happen. Think about that. If our blood vessels are constricting, our vascular blood flow is decreasing. That means we can't concentrate, we can't think, we get spacey. If that happens in the lungs, we're going to develop symptoms like asthma, where we can't get the oxygen that we breathe in, but everything's constricted. We can't breathe the air out. Think about what happens in the gut. If the gut is happening, if that's happening, the gut spasming. We get symptoms of colitis, chronic constipation, or IBS, any of these diseases that can have an impact on women's cycle regulation, hormonal regulation. It can have an impact on a number of things. Migraines, tension headaches. So breathing changes our biochemistry, changes our nervous system, and can impact our health.